Hi guys, Gary here at Up and Running. Just going to talk about a condition that we see really often in the clinic. It's a condition that is extremely prevalent amongst the community, which presents as heel pain, particularly underneath the heel in this region. It's often a result of overload of the plantar fascia, plantar fasciitis, or plantar fasciopathy as it's known. So the plantar fascia, as you can see here in green, is that really tough band of connective tissue. So it has attachment points across the whole base of the heel, runs underneath the entire foot with slips that attach into the base of the toes. So it has a really important role to play in stabilizing the arch, particularly when we're weight bearing and at that, the timing of the gait cycle where we're transitioning into push off. So it has to undergo high repetition and high impact stress day in, day out. And so it's therefore vulnerable to injury, particularly with changes in activity load. So that might be someone taking up running and doing too much too soon. It's really common with people that are working on their feet a lot. So just the overall load and stress on their feet is extremely high. So I guess the important part of managing plantar heel pain is getting a clear diagnosis. It's not always the plantar fascia. There are a number of other potential diagnoses that might be contributing to that pain. So really being clear on that is super important from the outset. Some other, causes of plantar heel pain could be the fat pad just deep to the skin, might be bruised. There could be deeper bony bruising in the heel itself. We can also have an impingement or nerve entrapment locally or further up in the ankle that could be referred down into the heel. We could even have nerve pain referred from the lower back and sort of glute region. So getting a clear diagnosis, of course, is really important for that. With your more classic plantar fasciopathy, it is generally a tension overload issue. So there'll often be a biomechanical imbalance that might be contributing to that overload. So initial stages of treatment is just offloading as much as we can, modifying load, whether that's around sport and fitness activity. If we can, stay off our feet a little bit more, strapping, padding, certain footwear that really helps to offload that area. Depending on the severity and how much of a biomechanical involvement there is, we might need to take it a step further and look at orthotic therapy and also, we always place an emphasis on the strength and conditioning aspect of managing any sort of condition like this. So, a structured progressive loading program over a few months to really make sure that tissue has the opportunity to adapt and get stronger to prevent a recurrence. So hopefully that helps to gain a bit more insight into plantar heel pain and particularly plantar fasciopathy. Of course, if you're experiencing this condition, please reach out. There's more information on our website and our online booking link is also on our website. So thanks guys, see you soon.